Okay, ready to go. Good morning. Nice to see you here in the room. And one of my children told me this morning, Maman, try not to speak too much today. So we'll try to keep it as short as possible. I'd like to just touch on the epidemiology of COVID-19 in the region and Canada, a little on vaccines and testing at the points of entry. There are no new cases of COVID-19 to report today in Prince Edward Island. We currently have 8 active cases and have had a total of 328 since the pandemic began. During the last week, there was a 14% increase in cases in Canada, with almost all provinces reporting higher case counts. This upward trend is concerning, given there were signs that case counts were actually decreasing a couple of weeks ago. So the 4th wave of COVID-19 is continuing in Canada. In Canada, hospitalizations continue to occur mainly among unvaccinated individuals. The average weekly rate of new cases of COVID-19 in unvaccinated people was 7 times higher than in the fully vaccinated. However, there are differences observed between the age groups. The incidence rate among unvaccinated compared to fully vaccinated ranges from 19 times higher for those in the 12 to 19 age group to 5 times higher in people over the age of 80 years old. In terms of hospital admissions, the numbers also differ by age, with unvaccinated adults aged 12 to 59 years being 45 times more likely to be hospitalized, and adults over the age of 60 being 18 times more likely to be hospitalized compared to fully vaccinated individuals. In PEI, since January of this year, 81% of cases were not fully vaccinated, and the remaining 19% were fully vaccinated. Being fully vaccinated decreases the likelihood of being hospitalized with COVID-19 and reduces the chance of spreading the virus to others. It was this time last year, in November 2020, we were anxiously awaiting our first shipment of 1,950 doses of vaccine. And since last December, over 271,000 doses of COVID-19 vaccine have been administered to island residents. So our objective of our vaccine strategy remains unchanged, to get as many people vaccinated, and it is happening. As of Saturday, November 13th, 94.1% of eligible island residents have received at least 1 dose, and 89.8% of people are fully vaccinated with 2 doses. Over 85% of individuals aged 30 and over are fully vaccinated. The vaccine rates in those under 30 remains a bit lower, with only 79% of individuals aged 20 to 29 and 81% of youth aged 12 to 19 years being fully vaccinated. I encourage individuals under the age of 30 who are not fully vaccinated to book an appointment today. In accordance with national recommendations, we are giving boosters to residents who are eligible. We are anticipating that Health Canada will soon approve the Pfizer vaccine for children aged 5 to 11. Once approved, PEI will receive 12,000 doses of pediatric COVID-19 vaccine, and we will begin offering immunization for children at community clinics as well as school-based clinics. The recommended interval between first and second doses for children will be confirmed by the National Advisory Committee on Immunization, but it is expected, I would think, to be around 8 weeks. And we'll speak more about the childhood vaccines when it arrives here in PEI, but PEI does plan to make the vaccine for ages 5 to 11 widely accessible by offering parents a choice of attending a community-based clinic or choosing an option for their child to receive the vaccine at school. And only children with consent forms signed by a parent or legal guardian will be able to receive the COVID-19 vaccine at school. And as the main vaccinators of children in PEI, public health nurses really are the experts in the safe administration of vaccines to children. The other thing I just might touch on is that the Pfizer vaccine has been specially formulated for children aged 5 to 11 years old, and it contains a third of the dose compared to the formulation designed for those aged 12 and up. Again, more details will be available in the next couple of weeks. We recently received 500 doses of Janssen vaccine, a single-dose viral vector vaccine. It will be available at a small number of pharmacies later this week. The Medicine Shop in Alberton and Summerside, Murphy's Queen Street Pharmacy in Charlottetown, Sobeys Pharmacy in Stratford, and McKenna's PharmaChoice in Montague. NACI recommends messenger RNA or mRNA vaccines over viral vector vaccines. However, some individuals are unable to receive an mRNA vaccine due to a contraindication, and others may have a personal preference for a viral vector vaccine. Individuals who wish to receive the Janssen vaccine can contact one of these 5 pharmacies. We are pleased to advise that long-term care and community care residents have been offered their COVID-19 boosters. NACI has identified certain populations who may be at risk of decreasing vaccine effectiveness over time, including our long-term care and community care, and those are people who are immune compromised who require a third dose of vaccine for optimal protection. In addition, people in the following groups are recommended for a booster, provided it has been 6 months since their second dose: adults 70 years and over, adults in and from First Nation, Inuit, and Métis communities, and individuals who received 2 doses of AstraZeneca or 1 dose of Janssen vaccine. Also, healthcare workers who provide direct patient care who received their first 2 doses, where the interval between those doses was 28 days or less, are also recommended to receive a booster if it has been at least 6 months since their second dose. Individuals who are eligible to receive a booster or third dose should contact a partner pharmacy via the website to book an appointment, or book online with a public health clinic, or call the vaccine booking line at 1-844-975-3303. And I really would encourage, if you are eligible, to book your third dose. Over the weekend, the volume of incoming traffic at Borden was high. Between Friday and Sunday, almost 8,500 travelers entered PI via the Confederation Bridge. When traffic is heavy, at some points, it is necessary to enter into what we call contingency for testing. It's an operational protocol that allows us to limit the number of people being tested when traffic volume and flow is a concern. We've had to enter contingency mode when we reach capacity to hold vehicles, as it is neither safe nor permissible for vehicles to be backed up onto the bridge. Alternatively, we have to go into contingency when we reach testing capacity. Tests have to be analyzed within 1 hour of collection, or they expire and become invalid. And there are various levels of contingency for testing. However, at a minimum, travelers who are not fully vaccinated are always tested. All individuals who enter the province are screened at the points of entry. We never go into contingency mode for the screening of travelers. Anyone who traveled to PI by the bridge who was not tested at the point of entry should visit a testing clinic to be tested for COVID-19. In accordance with public health recommendations, all individuals aged 12 and over traveling to PI should, in addition to an initial point of entry test, also be tested at a drop-in clinic between days 4 and 8. All school-aged children under the age of 12 who traveled outside of PEI should have a negative test prior to returning to school. In addition, they should be tested twice more on day 4 and again on day 8. And anyone with symptoms should be tested regardless of a previous negative test and regardless of their vaccine status. I encourage all families with children under the age of 12 who have not done so already to pick up rapid antigen at-home screening test kits at any Access PI location or at your school. The rapid antigen test should be used if a child has single mild COVID-19 symptom and does not have easy access to a health PI testing clinic. Rapid antigen tests are screening tests, and are not as sensitive as lab tests or even the ID Now machines that are used at the points of entry. A negative result on an antigen test should be repeated in 48 hours regardless of symptoms. A presumptive positive result on a rapid antigen test must be confirmed by a lab-based PCR test available at a testing clinic. We are in a much better position this year when you look compared to last year, this time last year. In 2020, Christmas holiday travel was difficult for family and friends who wanted to spend time together. Now, many Islanders, many Canadians are vaccinated. While we still are advising to use caution regarding travel, people, if they're coming home for the holidays who are fully vaccinated, will be required to test on entry and again between days 4 and 8. However, they will not have to self-isolate. Individuals who are not fully vaccinated will be required to self-isolate for 8 days with testing. Travel outside the province is not recommended for individuals who are not fully vaccinated. Discretionary travel from PEI to hotspots or circuit breaker areas in New Brunswick is discouraged. Discretionary travel to PEI from circuit breaker areas is also discouraged. Our colleagues and neighbors in New Brunswick are working to contain the spread of COVID-19, and travel restrictions are important. We are all weary of COVID-19. We all want to know the exact path out of this global pandemic. And believe me, there's nothing more I would like to do, and I know that you share this, that we could speak with certainty about how and when we will transition from responding to COVID-19 pandemic to living with COVID-19. What I do know is this: what we are doing is working. And for the time being, as we go into winter, we will continue to focus resources on our border screening and testing measures to allow for early detection and isolation of cases. Roll out our vaccine strategy that we've been doing by vaccinating Islanders with first, second, and third doses, and begin immunizing children aged 5 to 11 as soon as the vaccine is approved. We want to continue to maintain access to lab-based PCR testing and expand access to rapid antigen testing for Islanders, organizations, and businesses. Manage outbreaks and cases by early detection, testing, isolation, contact tracing, and follow-up. And vigorously protect our health system capacity to ensure emergency, elective, and diagnostic services are available to those who need them. A few days ago, I mentioned to a family member that it'll be wonderful when we're on the other side of COVID-19. And this family member reminded me of my own words. We are not there just yet. And now is not the time for you to take your foot off the pedal. So as we reflect on these wise words from my mother, and as we really continue to have resolve to navigate our way through COVID-19, let us continue to be patient and continue to be kind. Thank you very much. And we'll open it up to questions. I don't know, Wayne, do you want to go first?
Yeah, Wayne Toledo, CBC. Hello, Dr. Morrison. Good morning.
Good morning.
I want to ask a bit. You talked about the border at Wood Island, at Borden Carleton Federation Bridge. A lot of Islanders have seen that structure go up in place, and we're wondering if that's a sign that COVID and the testing at the border is here to stay for a very long time. Can you speak to why that structure was constructed, and does that mean that we will be testing for months, years, maybe ahead?
So the first part of your question, Wayne, is really it is important if we want to continue testing into the winter months that the people who are screening and doing the testing up at the points of entry at the bridge, it's windy and cold, and it's really some pretty wild conditions. So it's really to try to make sure that can take place. We also have to make sure the testing machines are in an environment where they're not going to be damaged by the elements as well. So when we look ahead of and actually based on our experience, our borders have really helped us throughout this pandemic, right from the beginning. We have people who test positive at our points of entry every week, and some are not reported here as part of our case count because they turn around and go back to their original province, and then we let their own provinces know. So I think the borders and the point of entry testing has been important for us. We are pretty well unique, I think, in the country at being able to do this in some way. Because we're an island, it's a little easier for us to do that. But I know Newfoundland's doing testing, and also looking to, even possibly enhance that as well. So when we look ahead, I do anticipate this testing will continue certainly through the fourth wave and likely through the winter, but this will not be there forever, but I would anticipate it will be there through the winter.
I want to ask you, too, a bit about some of the restrictions that are in place. As you say, we have a low case count. We're very lucky in Prince Edward Island. We've seen some other jurisdictions drop mask mandates, for instance, and stuff like that. We're all still wearing masks in here behind the cameras. Yeah. Do you see or anticipate allowing Islanders to go without masks anytime soon?
Well, I think you're asking, Wayne, the questions that I know we're hearing about. But in terms of what we're doing in terms of our Vax Pass events, some of our vaccinator test policies, our masking measures, and really our overall testing approach, those I don't anticipate seeing large changes in as well until at least we get through this fourth wave, and and through the holidays. I don't anticipate that will change, but we're always looking at the evidence. We're very much influenced by the cases and the hospitalizations, both in our neighboring provinces, but right across the country. And we want to make sure that people are able to do the most things they can with the minimal amount of restrictions while keeping everyone safe. And so at this point in time, we will all look forward to taking the masks off again, but it's one more layer of protection. And we've talked about that different times, how the various layers of protection can really help us.
My last question, you mentioned about the rising case counts we're seeing in some other jurisdictions across Canada. Certainly some areas of the world are talking about a fifth wave. How concerned are you about those rising case numbers, and do we need to do anything different because of that?
It does concern me when we start to see those numbers go up again across the country, and some of it is being driven, certainly in Ontario, a lot of the increase of their cases has been driven by young people who are not vaccinated, and so it is a concern. I think it's not that we should do anything different at this point in time, but I think it means that we should continue, back to your previous question, we should continue to have the measures in place that we do in PEI. They really appear to be working, and we are trying to minimize people getting sick, minimize spread, because if we can all continue to live and work and play in an environment where we don't have widespread community transmission, that's good for everyone.
Hi, it's Alison Jenkins from The Guardian. I have a question from a reader who was wanting some clarification on some smaller public events. They were wondering, for instance, municipal meetings. They're just looking for clarity. They're asking for a Vax Pass, they're physical distancing, and they're wearing masks, but they're wondering if it can be more like a larger event, like a hockey game, where you have a Vax Pass and everyone just wear a mask. What's the rule for that kind of thing, those in-between things?
Well, and I think that's what's laid out in the order around what's considered a Vax Pass event.
Clarity on
yes,
was, yeah.
And so we actually have people who respond to exactly that kind of question, because there are some some things that are sort of falling in the middle, I think, are difficult, and so they are looked at, and certainly we can help give guidance from the office. So certainly, if you want to have them reach out to our office, we will, and if there's not a clarity, it's discussed as a team, and we'll try to provide as much direction as we can. I mean, the Vax Pass is one more layer, but we also think it's important that the Vax Pass is not applied in certain situations, that we don't want it applied to grocery stores. You know, it's important that everyone has access into the grocery store. Vax Pass is not applied to faith-based gatherings. So there's a number of things that are not, it doesn't apply to. But the ones that are is to really allow more people in, and that's what those Vax Pass events are created for. But there's certainly lots of questions about we're getting asked the question, can we do a Vax Pass event even if we may not be on that list? And so those are the ones that it's important for us to talk to the your reader about.
Perfect. As far as non-vaccinated people, is there a timeline is there a herd immunity level or something where they'll be able to reintegrate with the rest of us?
Well, I think a great question, Alison. So we know from other vaccines that it's when the whole population gets a certain very high level of vaccination that it protects those who are not vaccinated or who don't mount the same response to a vaccine, those who are immunocompromised, for instance. And I think with COVID, this is a brand new virus. You know, people don't have any sort of innate protection against it. So that trying to figure out exactly how high level of vaccination we need to protect everyone is not as clear as we might have thought a year ago. We've heard Dr. Theresa Tam, Chief Public Health Officer of the country, say we should aim for 100%. And we may not get to 100%, but I certainly would like to see us as close to 90% of our overall population. And so right now, when we give those percentages, they're based on eligible population. But we still have a large group, 19,000 islanders who aren't eligible, for instance, as well as those who have not been vaccinated. So that's why it's important that the whole population, as high as possible, be vaccinated so we can protect those who are not vaccinated by choice or because they can't, because it's a contraindication, or who may not mount the same response.
Okay. I do have one more question. It's about boosters. You've touched on it already for who's kind of eligible. Will it be eventually everybody who's encouraged to get one?
So, Alison, I think you've heard some other provinces sort of moving in that direction. And I'm really waiting for the guidance from NACI, National Advisory Committee on Immunization, to give the recommendation on other populations that haven't been indicated yet. And they're looking at the evidence around that at the moment. I certainly wouldn't be surprised if that eventually happens, but at this point in time, it's really focused on those groups we've mentioned. And then as the evidence evolves, we'll make those adjustments.
Thank you very much.
You're welcome, Alison. Nice to see you.
Good to see you.
Louise Martin, CBC.
Hi, good afternoon, Dr. Morrison.
Hi,
So I'm just wondering about medical exemptions for the Vax Pass requirements. I think CPHO says it's granted 43, and I know all along it's been saying it expected there would be very few granted. How high is the bar for getting a medical exemption?
Hi, Louise. So the medical exemptions are very much based on the recommendations from NACI. Very similar approach in terms of what is considered qualifying for a medical exemption is being used in most jurisdictions. Certainly very consistent within Atlantic Canada as well. And And so I think I think it's the good thing is that we're all doing a very similar kind of list of what is considered medical exemption, and I think that's important. And in Prince Edward Island, if people an individual is requesting a medical exemption, they need to see a physician or a nurse practitioner, and they have the exemptions listed on the form, and then it is sent into our office, and we have, as you mentioned, 43 exemptions have been granted, and so that may be someone who had an adverse event after their first dose, so they cannot, we don't want them to get the second dose, so that would be one example, or if they have anaphylaxis to a component of the vaccine, so that would be another reason for an exemption. We also review the APHEs, or the adverse events following immunization. So there's some review if that's necessary in the office as well. We've had 5 requests that have been denied as they did not actually meet one of the criteria laid out, and those, as mentioned, are national criteria.
Some employers bringing in vaccine mandates consider religious grounds for an exemption, and that's certainly something you've heard with other vaccinations for other diseases and viruses. So, will the province consider any religious basis for an exemption?
So, very similar, Louise, to most other jurisdictions across the country. Our office is not reviewing, won't be looking particularly at religious exemptions for the most part. We are really focused on medical exemptions, and there are. And this is, of course, it's exemptions not for a mandatory vaccine. We are talking about exemptions here for the Vax Pass events, and that is, as we've pointed out before, time limited, and why we also think that there's certain things that shouldn't be Vax Pass events, including faith-based gatherings.
We often see the question from people who are perhaps hesitant to get the vaccine, that what's the point in getting the vaccine because vaccinated individuals are still getting COVID-19. Can you explain maybe a little bit about why those who are unvaccinated might be contributing to the mutations that are infecting people who have been vaccinated, perhaps?
So, Louise, I think, because it's an important question, and I think that's why I was trying during the notes to talk about that increased risk for those who are unvaccinated in terms of cases and also hospitalizations, because I think that sometimes helps understand that there is that just increased risk if you're unvaccinated in terms of a potential spread of illness. Those who are vaccinated have decreased chance of ending up in hospital. They have decreased chance of spreading the virus, and that's. And that's not, there's evidence right across not only the country but the world in this regard. So it's, we're trying to keep everybody safe and healthy. And I think when we talk about those risks, that, those unvaccinated adults 12 to 59 being 45 times more likely to be hospitalized than those who are fully vaccinated, I mean, that's significant. And trying to in talking about that, have people understand that the vaccine is not 100% effective. And we know that. But we know it does, the evidence says it will decrease your chance of severe outcomes. And we've tried to emphasize that through the last year. But it also is why there are other layers of protection that we need to have as well. Why masking continues to be important when you have a certain level of infectious disease pressure. If you have very little disease in circulating, then your chances of getting sick are certainly reduced. So it's a message I know we've been trying to talk about for a long time, but I'm glad you're asking the question because it gives us a chance to sort of re-emphasize it.
Sorry, I was talking more about the variants and of concern, and I've read in several documents and articles that those sort of the COVID virus mutates because of the unvaccinated population. Is that accurate? Does it get you get these more variants because there's still a large chunk of people who aren't vaccinated?
So the viruses like to go to hosts where they can continue to grow, and we're seeing mainly the Delta variant, although there's different subtypes of that Delta variant that are being seen. I don't believe those strains are not unique to those who are unvaccinated. So it's not that it gives the virus a chance to certainly change a little bit, to sometimes grow or to propagate more quickly. And that's why it's important that not only are Islanders and Canadians vaccinated, but it's going to also be important that many people across the world are vaccinated. And you've seen the WHO come out and talk about even the ethics around that, so that we don't have those kinds of vaccine escape mutations that you're talking about, Louise. That's why it's important. Our goal continues to be vaccinate as many people as quickly as possible, so it doesn't allow for that kind of chance of variants changing, and that we can protect everyone as quickly as possible, and then hopefully then start reducing some of these measures when we're in a different place.
Thank you. Thanks for explaining that. I much appreciated.
Yeah.
Gabrielle Drummond, Radio Canada.
Bonjour, Dr. Morrison. Ma question, c'est par rapport aux voyageurs qui sont entrés à l'île du Prince-Édouard en fin de semaine sans se faire tester. Est-ce que la santé publique a une idée de combien de personnes? Est-ce que c'est une dizaine, des centaines de personnes qui sont rentrées à l'île sans se faire tester? Et dans quelle mesure ça pourrait représenter un risque à la population de l'île?
Bonjour, Gabrielle. Alors, on mentionne que chaque jour, ce week-end, on a eu à peu près, comme samedi, 2100 personnes qui ont voyagé à l'île du Prince-Édouard. Mais c'est juste moins que 2000 de tests qu'on peut faire. Alors, ils vont faire tester les personnes qui ne sont pas vaccinées, mais on encourage les autres, s'ils n'ont pas été testés au point d'entrée, il faut être testé avant de retourner à l'école ou faire des visites ici à l'île du Prince-Édouard. On sait que, parce qu'on regarde le nombre de tests chaque jour qui sont faits aux cliniques, on sait qu'il y a un bon nombre de personnes qui sont testées chaque jour. Alors, ça ne m'inquiète pas tellement, mais j'aimerais que tout le monde est testé. On sait que personne pense que ça va être eux-mêmes qui est positif. Alors, et on a peut-être un tiers des cas à l'île du Prince-Édouard qui n'ont jamais des symptômes. Alors, c'est important d'être testé quand même, mais vraiment, si vous avez des symptômes, il faut être testé.
et comment allez-vous vous assurer que tous ces gens-là, ceux qui n'ont pas encore se fait tester, qui vont se faire tester, est-ce que la santé publique va faire ou est en train de faire un suivi avec ces personnes-là?
Non, on n'a pas d'un suivi. Il faut juste comme dans tout vraiment beaucoup de mesures de santé publique, on demande aux gens. On a fait hier une annonce avec le média pour encourager les gens qui sont manqués au point d'entrée d'être testés. Alors, et puis on va continuer de tester les gens qui viennent aux cliniques ou qui ont des symptômes.
Excellent. Merci beaucoup.
OK,
Bonne
merci.
journée.
OK, bonne journée. I think that might be it. Yeah. Okay. Okay, thank you very much. Yes, certainly.
With students and children being vaccinated, do we know how long that process will take once we're given the green light to go?
I don't have the exact number of dates, but public health nursing is working with the school system for the school-based clinics, but also community-based clinics. They're sort of getting them ready in anticipation of the announcement. My feeling is that they'll be able to get a large number of them done before Christmas, but I guess we'll see when it actually comes out and what that expectation is in terms of timing once it does.
The approvals happen as you expect. You hope to get a vast majority done before Christmas.
Yes,
All right. Thank you very much.
you're welcome. Okay, thank you.